Fortified City TV presents Health Matters. We bring you education and awareness on your health, the total person, your spiritual health, your physical health, and your financial health. Please join us, faith leaders, professionals, and community leaders, this Thursday and every Thursday at 6 p.m. CST or 11 p.m. GMT for a life-changing encounter. Your health matters.
This place right now. Believe it. Believe it. Believe it. Hello and welcome again to another edition of Health Matters. Wherever you are, whether it is in the morning, evening, you are welcome to this program. You can share the video, invite someone to be part of what is happening at this time. Today, we will be discussing your prostate health. So I'm calling on all the guys, all the men, all the boys. This is very, very important. There are things we take for granted, which we ought not to do. So it will do you good to be part of this information in the awareness section. And so you can also be able to pass the message on to someone you know, someone you love, someone that needs to hear this. Whether you are a guy or you are a lady, you have brothers, you have friends, you have fathers, you have uncles. I mean, you can still pass the message on, or you can, send them the video and let them be able to watch it whenever they have the time. You are welcome again. This is Health Matters, and this is a presentation by the Fortified City International Ministries here in Minnesota. And we are glad to have with us tonight our special guest. I would say she's not a guest. She's one of our household physician and certified. So all the people you see on this platform, they are all certified physician. They are actively working in the various fields. So we are here to bring you this awareness and this information so you can be able to consult your doctor or primary care physician, whatever or whoever that person is. So there are signs and symptoms that we talk about. And it is important if you are, having these signs or symptoms so you can seek the proper help. And so tonight I have with me my friend and sister, Fasia. She's going to be introducing herself and call all the titles that she wants to call. Okay. That's okay. If you are here with us, just stay tuned, okay? Do us a favor, please don't forget to share the video. You are blessed. And those that are sick tonight, healing is coming your way in Jesus' name. So you are welcome. You want to introduce yourself to our people tonight again?
Sure. Yes. Thank you for having me back. Good evening, everyone. My name is Fasia Hilton. I am a proud Liberian and alumni of Cathedral High School, your alma mater as well.
Thank you.
I am a family nurse practitioner. I've been a nurse practitioner for 16 years, going on 17. And I've been a nurse for 24 years, going on 25. So don't let this little face fool you. But my specialty is primary care, family practice, actually. When I say family practice, what do I mean? I mean that I can see from day one, from conception, pretty much, from conception up until the end. Okay. Or if you want to say from day one of birth up until the end, and including pregnant women as well. So, and that's for both men and women. Well, not pregnant men, they're not pregnant. But anyway, I see both. But now I specialize in lung cancer screening. So that is my background.
Well, good. That's very, very impressive. Thank you. Thank you, Fasia. I mean, it's good to have such a, knowledgeable person always on this platform. So to tell you that we have you at heart, your interest is our paramount concern. And so we always try to bring you the best. This is Health Matters, and your health matters.
Yes.
So tonight we'll be talking about prostate health. I want to know, and I'm sure you are also eager to know what this is all about. If you are a guy, you need to be seated right now.
Yeah.
Seated at this, wherever you are, whether it's your phone or your laptop or, but you need to be watching this because it is important.
Mm-hmm.
If you are a lady, it is also important. Be there and share the video and also talk to that person, that male person that you have in your life. They need to be, part of this discussion tonight. We have our numbers here. Let me put it on the screen. I want you to know that we are going live also in Lofa County, Monrovia, Liberia, and not Monrovia again, Lofa County, Liberia. We are beaming live on the a radio station in Lofa. And those that are in Lofa, our number is 952-201-9287. You can text us. You can also call us on WhatsApp. The number is on the screen. You can call us or you can text us and be part of this discussion. You can ask your questions. And, if you want to say anything, make a comment, you are free to do so. And we will try as much as we can to, answer whatever way possible. So you are welcome. You are welcome again. Health matters. And so tonight we want to know what prostate health is. If we are talking about that, because we know this is something that affects the men, we want to know. Fasia, you want to help us tonight. We need to know. We need information.
Okay, so your prostate, is part of the male reproductive organ. It is a walnut-sized gland that sits right. It's located between the male bladder and the penis. So pretty much it is wrapped around. There's a tube that runs from your bladder to your penis called a urethra. Okay.
Yeah.
So it is situated in between the urethra. Okay, it's wrapped around it. So we'll call this the urethra, and then so this is the urethra. And the urethra is where the urine flows through to come into, come out of the penis, where it comes through the ureters. Okay, so I know the urethra and ureters, they kind of tongue tying, but so that prostate it wraps right around it, and it's what we call a walnut shaped gland. And so what that prostate does is it produces fluid that it gives nutrients to the sperm, the sperm. All right. So that gland that sits there, it should not be painful. It should not be swollen. It should not be bumpy or anything like that. Okay. So when that gland starts to swell up, all right, it squeezes your urethra. So this is, I'm using the pen as an example. Okay. It squeezes that urethra. And so it kind of kinks it and makes the hole in the urethra smaller. So it's like, an example I would give is if you have a straw, okay, and you're drinking through a straw and you're holding it, you're drinking it, the whatever you're drinking is going to come out, normally. But if you put a kink in that straw and you're drinking, can you hear me?
I can hear you.
Okay.
I can hear you.
If you put a kink in that straw, okay, now and you try to drink, yes, you will get some, whatever you're drinking, you will get some out, but it's going to be harder. Okay, so that's the analogy I give my patient. If their prostate is swollen, it's going to squeeze that urethra And so your urine stream will not be as fluent.
That's right.
Okay.
Okay.
So symptoms of prostate enlargement, which we call the abbreviation we use is BPH, benign prostate hypertrophy. So if it is enlarged, then at night you will start to go to the bathroom more frequently. However, when you do go to the bathroom to pee, your urine stream is supposed to come out like shoot out, okay? But instead of it coming out, it's gonna come out.
It's having breaks.
Yes, it's gonna have breaks and it's gonna have drips. So you won't be able to empty your bladder fully. All right. So that's why every so often at night you will want to get up to go to the bathroom because you didn't completely empty your bladder. All right. So and then the last time when I did the talk, another symptom of that is when you are doing number 2, when you are defecating and you are not constipated. All right. And the stool is coming out. That stool, when you're doing number 2, it should not be painful coming out. But if you see that you're doing number 2, and you are not straining, you are not constipated, but when that stool starts to glide out, because it has to pass by the prostate to come out. So when it comes out and it's painful, that's a telltale sign to see your doctor.
Okay.
And so this program tonight, we're going to do it differently. It's going to be an interactive program. Instead of doing a slideshow, it's going to be interactive where you will have questions. It's a Q&A, pretty much. All right. Now, I don't know it all. If I don't know the answer, I will tell you. I will find out, and I will get back to you. Nobody knows it all. We learn every day.
Exactly.
All right. So now when you start to have problems with your urine stream and you come to me, then I will do a digital rectal exam. That's one of the first exam that I will do is a digital rectal exam, DRE exam, and I use my finger. Okay. So I will put glove on, double glove, and I will put my finger in your rectum. Most men don't like that exam. And the age we start doing this exam is at age 40. Okay, age 40 and up. So I will put my finger in there and I will feel your prostate. And I will feel all around it. It shouldn't be bumpy. It shouldn't be swollen. You shouldn't have any pain. I mean, it's not the most comfortable thing for somebody to put the finger in your rectum, but at the same time, it should not be painful. Okay, so I will feel just to get a sense of what your prostate feel like. Like I said, there shouldn't be any bumps or gravel or grooves on it. It should be firm and not painful. All right, and then I will also do a lab test, and that lab test is called a PSA level. And so most times, and PSA is the prostate specific antigen level. Okay, that is specific to the man. All right. So the normal is 0 to 4. So 0.0 to 4.0. However, the way I learn it is before I do a PSA level, I like to do what we call massage the prostate. I do the exam first, check it to kind of release some of those antigens. So I can get a.
Let me hold you there. When you talk about, before you go further, when you talk about massage the prostate, what exactly do you do?
Well, doing the exam is when you're touching and feeling anything, you're massaging it.
Okay,
that's what I mean. I'll go in and do the exam. Yes. So when you're feeling it and touching, each part of it, it's just a medically correct term to say you're massaging the prostate. Yes.
Yeah. And
then once I get that exam, which should be a normal exam that you do when a patient comes to you for their annual, or if it is your first time seeing them. When I say annual, I mean their physical exam for the man. This is only specific to men. And so that should be part of your routine, exam and your routine lab level. So when a patient comes to me, I will do that exam. You have to be 40 and over, do that exam. And then that would be part of my basic panel, lab panel that I would do for that male patient. And so once I get the baseline of the patient, so let's just say if the patient lab level is that PSA level is 0.2, okay, which is normal. Like I said, the normal level is 0.0 to 4. So I get a baseline level, and this is my first time seeing the patient. I get a baseline level, and it's 0.2, which is normal. Okay, but then let's say maybe 2 months later, he calls with symptoms that, you know, he's having, and this is a 40-year-old man. He's having symptoms, you know, with his urine stream, going to the bathroom at night frequently. Now, going to the bathroom frequently at night, or often more time, more than 1 or 2 times a night, doesn't necessarily mean that it's your prostate. It can be diabetes as well.
Yeah.
That's a different talk. Okay. So if I do his level and his baseline level, the first time I saw him, I did his PSA level is 0.2. And then a month later, he calls me and said, oh, I'm having this symptom, you know, I'm having a problem finishing my urine stream, is dribbling and stuff. And so I'll say, okay, come back in. And then I'll do an exam, and I feel, from the last time I did his exam, you know, it feels kind of swollen and stuff. And then I will draw another level. Now, if that level comes back and it is 0.6, okay?
Yeah.
Though that 0.6 is still considered normal, but for him, that level has double.
That's right.
Okay? Actually, it has triple, because doubling would be 0.4. So it has tripled to 0.6. It shouldn't be that way. Okay. All right? So then I will give him some medications and see if that helps. I will tell him then come back in, you know, 2 to 4 weeks, and we will check it again. If he's not having any other symptoms besides the urine stream, and then I check it again in 2 to 6 weeks, 2 to 4 weeks, and that level goes up again, then I have to refer him to a urologist. Because if that level keeps going up, even though it is considered a normal level, but for him, it is not normal. Safe.
Yeah.
Yes. So you can have a normal level of a PSA and still be diagnosed with prostate cancer. So that's what, you know, most people don't know that. They think, say, oh, but it's normal. Let's just treat and treat and treat and treat. No. And then if I put him on the medication and I see that his level is not coming down, I'll still refer him to the urologist, and that's the male specialist doctor. You know, that's he takes care of all of the from below the belt, including your kidneys.
Okay. So the exam, the posture exam, how many times when you reach the age, how many times do you have to take that exam a year?
Some people do it once a year if they are not having symptoms. Me, I like to be proactive. It doesn't hurt.
All right.
Okay.
So
if I see a patient that has comorbid condition, meaning they have more than one medical condition, more than one medical diagnosis, like if they have diabetes, they have high blood pressure and stuff like that, those people, I see them more frequently. I see them every 3 months or every 6 months based on how well they are controlled. And if it's a male and you come in, it doesn't hurt. I will still examine your prostate, because within that 3 months, things can change. And the thing about prostate, you know how we say high blood pressure is considered the silent killer?
Yeah.
Prostate cancer is pretty much the same. Most times, they don't get symptoms until it has gone far advanced. So that's why that screening is very, 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 very important. So like I said, you know, I'm proactive, and I'll tell the patient, hey, do you mind if I do your prostate exam again? You know, some of them were fine, and we joke, you know, and they'll say, "Oh, look at your fingers." You know, we have a joke because I have long fingers and stuff. But you know, you have to have that rapport with your patients.
Yeah, make them
That's
more
where,
comfortable.
yes, that's where the holistic, you know, health comes in. When I take care of my patient, I don't only take care of the symptoms, I take care of them as a whole. You know, they will come to me and I'll ask them, "Oh, how's your day been? How's your family?" And then, you know, they will tell me, "Oh, my daughter is not well," and or my sister is not well. And they'll be surprised when they come back. I'll ask them, "So how's your sister doing?" That means a lot.
Yes.
It means a lot to them. Instead of me just coming in and, oh, their symptoms, and no, you have to treat the individual as a whole, because it is a relationship.
So true.
Some people are afraid to go to the doctor. So, you know, you have to make it where they are comfortable. They want to come and talk to you, and they should be able to talk to you and tell you anything. I'm not a doctor. I'm a nurse practitioner, but you know, most people, they consider us, you know, they'll call us doc and stuff. But I'm a nurse practitioner. So you have to be comfortable with your doctor or your provider, whomever that may be. Need it be a doctor, or an MD, or nurse practitioner, or physician assistant. We're all in the same, under the same umbrella. So you cannot just treat the symptom. You have to treat the whole individual.
Thank you.
So answer to your question, you know, if you do it once a year, if you do it and the lab is normal and they come back, you know, you can do it once a year. But I like to be proactive. So if they come in and I'm doing their labs, it doesn't hurt. If I ask them and they're okay, I let them know what labs I'm drawing, and so I will draw it. So it just depends on your provider. But once a year is okay, or every 6 months, or you know, 4 times a year. If you have the insurance, and you know, if the person doesn't have insurance, then that's a different story.
Mm-hmm.
You know, if they're paying out of pocket and you do it once a year or twice a year, you know, legally once a year is okay if the number is normal and then they're not having any symptoms.
Okay. Okay. I
Yeah.
want to know, those that they have gone through this surgery, that got to do with hormones, are they at greater risks of, you know, prostate cancer or something like that?
And if they're going through which surgery?
Those that have hormones.
Or hernia?
Yeah.
No. That I mean, that's two different. Well, there are different types of hernias. You know, you can have a hiatal hernia up in here. You can have a hernia up in your stomach. You know, you can have a hernia in your scrotum, where your sac, your
Yeah.
balls. You
Yeah.
know, that big sac. You can have a hernia there. So there's different types of hernias, but no, it shouldn't have any. There's no correlation. Now,
Okay.
if you do a colonoscopy, okay, if a male, and that we do at 50 and above, unless, and we do early if you have family history. That tube that they use to go through the rectum, it can irritate the prostate because you're gliding through the prostate. Now, it can forcefully elevate the level, or it might irritate the prostate and make your prostate a little swollen, which can cause an increase in your PSA level. So then that's why a good history from the patient is very important. And also men that are on that are taking testosterone, you know, the testosterone injection, need it be for what reason they are taking it. You have to find out if they're on that, because that testosterone hormone, if they're taking that synthetic testosterone, it can also increase your PSA level. And it doesn't only increase your PSA level, but it can also increase your liver enzyme level, and it can also increase your triglyceride level, which is a different story.
Wow.
Yeah.
So this is so apart from the exam, apart from feeling the posture, whether it's bumpy or whether it's, that exam you have to do yourself, what other symptoms you can look for, or they should be looking for?
Well, now the prostate exam, nobody can do it on themselves. No. It's only your doctor can do it for you. It has to be a trained medical personnel that will do that exam. The patient themselves cannot do that exam. Okay. But most times, like I said, you will have the problem with emptying your bladder fully, interruption in your urine stream. You will have pain with defecation. Sometimes when it's swollen, you might have pain down there. You might have pain in your rectum.
Okay.
So those are mostly the telltale signs. Or sometimes you might have burning with urination.
Because we know that burning with urination is also symptoms of other illnesses.
Of urinary tract infection, yes.
Yes.
But you come in and I get a good history on you, and you say you're having burning with urination, but when I check your prostate and it's painful, or it feels like it's swollen, and we do a urinalysis, and it's clean, then we know it's and I do your PSA level and it's high, then we know it's your prostate. Or if sometimes too, if you have what we call inflammation of the prostate, which is called prostatitis, you have infection. There's infection going on there. You will also have pain as well with urination, and we'll put you on antibiotic and stuff, and then have you come back and check it. If everything is okay, then that's what we want.
Okay, how should I put this question? What are some of the sexual habits that put you at a higher risk for for this
You want to dive into
You just go into it a little bit. Don't go deep.
Well, if a male is having intercourse in his rectum and you are promiscuous and not using protection, sometimes that can interfere with your, it can have problems. So, or if they're sticking anything up in there and it's not clean, and bacteria goes on your prostate, it can cause an infection. Am I saying that it's going to cause prostate cancer? No, but it can cause you to have what we call, prostatitis, where the prostate is infected. Okay. And and it gets on, and then we can treat it with antibiotic, and we can treat it with Flomax, which Flomax is an anticholinergic drug that we give that kind of relaxes the muscle of the relaxes the prostate and relaxes the urethra, so that your urine will flow, normally. It has no bearing on your PSA level. Now, the drug that affects your PSA level is the drug finasteride. Okay. That is the drug yes. So those are the two major drugs that we use for the prostate. One affects the PSA level. It should bring it down, which is the finasteride. The Flomax, you can give it to a person until Jesus comes. It doesn't do anything to the PSA level. But what it does is it relaxes the prostate, and it relaxes the smooth muscle and the urethra, so that you'll be able to, your urine flow will come out normally.
There's a question here I want us to look at. The person said, what if the infection go on even after the checkup? Even after you have gone through maybe the treatment and the infection persists, What's the next
But
option?
then that's out of my hands, and I will send you to the urologist, and then they will go from there. So then I will refer you to the specialist. There could be something going on with in your bladder as well. There could be a lot of different things going on down there. It could be the cancer. It could not be. Then they will do a specific, if your and if your numbers are going up, your PSA level are high, you know, then what your norm should be. Then they will do a biopsy. Okay.
Yeah.
And then after, when they do that biopsy, they will do a smear. It's called a Gleason score. All right. That Gleason score is what we use, or what the urologists use, to diagnose that you have prostate cancer. And that number, the Gleason score, goes from 6 to 10. So 6 it should be less than 6. All right. But if it's 6 and above, 6 will be okay, you have prostate cancer, but it's a low risk. However, you can have a level 6 of a Gleason score, but have a high level of cancer cells, because they would take that score and then they would do a smear and see how much cancer cells are on each of those. If your volume of cancer, your Gleason score is 6. I know this is confusing. It was confusing for me too. But if your Gleason score is 6 and they do a smear and you have a 90% volume of cancer cell, then they will treat. But if your Gleason score is 6 and you have a 20% cancer cell, they'll watch. So, I mean, you understand what I'm saying? Yeah.
Yeah. Okay, there's a question here. There's a question here. The person said that if a doctor diagnoses me as a person with prostate, should I avoid sexuality?
No. As long as you're not doing it in the rectum, no. I mean, that is individualized. If you're having intercourse and it's painful for you, you will be able to tell. But most times, no.
Okay, I was looking at, I don't know whether there's some truth in it, but you know, we might not be talking about nutrition, but they're citing food that, you know, some nutritionists that said it boosts your prostate health.
Which food is that?
Well, they listed some stuff like tomatoes, like broccoli, like green tea, and you know, fish and some other stuff. They say, you know, it's good, you know, that you can have. Because there are a lot of stuff that people say on the internet, you know, some are true and some are not true. So we just want to know, you know, how we can draw the line between what is just myth, what is, you know, the truth.
I mean, pretty much from that route, you know, whatever healthy you're eating is good for you.
Yeah.
You know, I haven't read that will affect your prostate, but I think those are foods that are considered non-inflammatory, meaning, you know, it doesn't cause inflammation, or it helps to prevent inflammation. So I can see where they're coming from with that. Okay. But to say that you eat this, you know, there's certain group of foods and you won't get, you know, no, I don't know.
Okay. Another person here want to know whether exercise is going to help. Whether if you exercise every day.
If you have an enlarged prostate, I don't know about exercise. No, it won't do anything with it. Exercise is good. It keeps you healthy. So continue doing that. But is there any correlation with the prostate? If it's swollen, is it going to shrink it? Because, you know, with exercise, you're losing weight. No, I don't think so.
Okay, there's another myth that when you eat canned food is a source of cancer.
Well, I mean,
I don't know to what extent.
Cancer generally If the canned food expire, if there's rust on the can, that's why when you go to the store, make sure you make sure you examine whatever canned goods you're getting. Make sure there's no dent on it, So and check the expiration date.
Yeah. Expiration date. But sometimes, especially in tier world countries, people don't really look at expiration date. It just
right. You get what you eat what you can get.
Yeah.
So we are just by the mercy of God, pretty much. Especially during wartime, nobody's going to look at expiration. You're happy to get something. So, and then I think at that time, the Lord works in mysterious ways. I'm pretty sure,
He was.
Yes, he knows that, it's war zone and people are trying to find food. I don't think he will put that on you. My late mother told me a story during the war, which I wasn't in Liberia during the war, but she said that they were walking, because we live in ELWA. She said they were walking from ELWA all the way down to Buchanan. And she said, she was exhausted. It had reached to the point where her feet were swollen. She was thirsty. She was hungry. And she wanted to drink. And in fact, they had to put her in a wheelbarrow.
Wow.
Yes. And so she said, I am so thirsty. And there were bodies, laying, how it was during the war, bodies laying down. And there was this little pond of water, this little puddle of water, muddy, dirty water. My mother was a woman of faith. So she said, I need to drink. And then, we call her Mother Dear. She didn't like for us to call her Mommy or Mama. We call her Mother Dear. So the truth said, Mother Dear, this water is nasty. She said, just give it to me. I want to drink. She said she took the dirty water
and drank
and
it.
She said the 23rd Psalm. And she drank that water. So, God, He doesn't put more on you than you can bear. And she had that faith that by saying that 23rd Psalm and drinking that water, and she said after she drank that water, she got the strength to move on. And she was healthy until she passed,
Yeah.
And years later, she passed 2 years ago. So God don't put more on when you're going through stuff. He don't put more on you than you can bear.
I know, right? That's what makes him the powerful God.
Yes.
Another question. The effect of prostate on fertility.
Okay, now the prostate, like I said, the prostate nourishes the sperm before it comes out. Okay, so if your prostate is not healthy, if your prostate is swollen, that can interfere with your sperm count. A healthy sperm count if you are of childbearing age. Okay, and also the nerve that communicates to the brain for erection in male, that nerve is wrapped around the prostate, which helps with erection. So if your prostate is not functioning well, you might not get a full erection. Yeah.
Okay. Another question here is that is it transferable?
I don't know. No. Now, it's genetics. If you have family history of cancer, prostate cancer, then, you could. But to say, you are a male and you have prostate cancer and your wife to say you're gonna transfer cancer to her in different parts of the body, or, like ovarian or female cancer, I've never heard that before.
Someone is asking about turmeric, whether it can stop cancer.
Well, there's studies that, turmeric is an anti-inflammatory.
Yeah.
And turmeric is booming right now. It's the big thing now. That you go to health food stores, you see turmeric capsules, you see turmeric tea. It is a natural anti-inflammatory. So it's good for you, but too much of anything is not good.
I know.
So you just have to watch how much it is. Yes.
Okay. And this person want to know they got a maybe low sperm count because I don't know what he called teen sperm, or maybe obviously it's low sperm count. He want to know his solution.
Well, I mean, I think some people's sperm is just not as thick. It's just individualized. Does that mean that your sperm count is low? You have to go to get it checked. And I don't do that in my clinic. That's not a lab that I draw. You have to go to the fertility specialist that will do that. Even the urologist will not do that. You have to go to the fertility specialist to do your sperm count.
Yeah. I might not be able to take, let me see. Someone talking about, with the swollen prostrate, what kind of exercise should they do? Should the exercise be intensive or should it be moderate? Because some people go through some vigorous exercise. I don't know.
It's all individualized. If your prostate is swollen and you're able to do vigorous exercise, then more power to you. Go ahead. Exercise. I'll say, yeah. If you're able to exercise and you're not having pain, why stop? You're doing something good for your body.
Well, someone talking about heart attack here. We talking about posture tonight. Can you tell me why are the main cause of a heart attack? We did that the last time. Maybe you just want to respond to them, just briefly. Heart attack got different reasons.
Yes, there's many different reasons. It could be where the heart attack pretty much, your arteries are clogged. Pretty much, you're not getting enough blood flow and oxygen to your brain or to your heart. All right. So that means your blood pressure is not controlled properly. You might have the medication, but you think by the medication sitting on the shelf, your blood pressure is going to be cured or going to be lower by osmosis. It doesn't work that way.
That's true. Sometimes people are afraid to take the drug and just bring it home and keep it on the table. The best
exactly.
Yeah.
So you have to take the medicine, or if your lipid panel is very high, you have to take that can cause you to have a heart attack, because some of that plaque, that fat that's in your arteries, that's in your vessel, it can dislodge, and then it can cause you to have a heart attack. So that's why you have to make sure that your blood pressure is controlled, that you are taking your medicine, your medications every day as prescribed. Don't let it sit on the shelf. People think that we as providers, we get cutbacks from the drug companies. We don't. We do not. Those medications are prescribed because you need it. So, but you have to take your medication, and you have to take good care of yourself, and you have to go to the doctor.
Yeah.
And especially with men, those, most men, they like to take that testosterone injection because it gives you energy. Some of them want to work out and to get that muscle, but there's a side effect to that testosterone injection. Like I said, it can cause your triglyceride, which is a part of your lipid panel. That's the saturated fat. The way I explain it to my patient, your triglyceride is the saturated fat. When I say saturated fat, it is anything that you eat, any fat that you eat that solidifies. Meaning, how when you butter, you can melt butter, but when you set the butter down, it solidifies. Solidify means it gets harder. Okay, it gets into a thick lump, like the butter, or like bacon. You cook the bacon, the grease in the bacon, if it sits down and gets cold, it solidifies. That's what I mean. So baking grease is considered triglyceride. It can cause you to have high triglyceride. Butter, anything that solidifies. All right. So your triglyceride level should be between 149, less than 150. But this testosterone injection, I've had patients where I will do the lab. They don't tell me they're on they won't tell you. And I'll do the lab, and the liver function is extremely high. And the triglyceride, the first time I did it, it was normal. But then instead of it being, let's say it's 160, that's high, it goes up to like 700, which is dangerously high. That's like, you got fat pumps in your arteries. Okay. So be mindful of taking those testosterone injection. Be very mindful. If you're taking it, make sure you are being monitored. There are male testosterone clinics everywhere. It's the big thing. Anyway, or you will see it on commercials, testosterone. You can come in and do your testosterone hormone, and we'll give you testosterone. And some people say they lose weight with it. Be very careful with that. Make sure you are closely monitored, because it can increase your PSA level, which is that is specific to your prostate. It can increase your triglyceride, that is part of your cholesterol panel, and it can increase your liver enzyme, which can make you. It can lead to another problem that can cause you to have, your liver failure, which is what we call, cirrhosis of the liver, or it can cause you to have liver cancer. So most times when their triglyceride is high, and let's just say if I do an X-ray or do a CAT scan, there will be something or a diagnosis called fatty liver. Yeah. Because it's fat acids on your liver. Okay, but that's a different, talk.
Okay. And a question here. Why are you guys tearing men issues more than women? Is it that
because all the time we focus on women, and you guys are important too? So that's why. Don't take it as a negative. It's positive, yes. Please don't take it. We always talk about women. You guys are important too. We have to talk about you guys and make sure that we are telling you what you need to know. Go to the doctor. And most men are notorious about not wanting to go to the doctor. They say, "Oh, I'm fine. I don't need to go to a doctor." That's just how it is.
That's true.
So hopefully this will help you to, decide to go and see your doctor and get a checkup. At least even if you do it once a year. That's if you don't have any high blood pressure, any disease process, and you're healthy. Still go to the doctor at least once a year to get your labs done. Let your doctor have a baseline of you.
So true. Yeah. So we want to say our final word. What is there any other side of this topic we have not treated tonight before we close, because our time is fast approaching? I know the questions are still coming.
It's 7:50 already. Oh my goodness. Yeah. So I think people like the interactive more than the slides, because I like that too. I like that. Yes, they can ask the question instead of me just looking at slides and talking. At least I can, you can give me questions and I can answer whatever I can. If I don't know, I'll tell you I don't know.
Yeah.
But yeah, I think the most important is, don't be afraid of the doctor. We are here for you. And also be honest with your doctor. Be honest and this is a service rendered to you.
That's right.
So if you go to this doctor and you feel like he or she is giving you all these medical terms that you don't understand and it's going in one ear and coming out of the other, he or she is not for you. Shop around, because you are paying me to render the service to you. Okay, so I should give you that optimal service. So if you come to me and you're talking, and instead of me looking at you, to see I'm busy typing. No, that's not great patient etiquette. No,
That's true.
that is an individual. He or she is paying his or her money to come and see you. Give them that attention. Give them that attention. I mean, I'm not saying you shouldn't type, but if you're typing, at least look at them and type. Now, some people might not know how to type without looking at the keyboard, but then if that's the case, then just, at least take some time and listen to the patient. But it shouldn't be the patient talking and you going, you clicking and clicking and clicking and not even no eye contact. No, because by looking at that patient, I can see more than what they're telling me. By looking at them, I can see their demeanor, I can see their gesture, I can see that there is more, there's something going on. But if I'm looking at my keyboard typing and clicking to try to finish, to be able to go to the next patient, I will miss something. I will miss their emotional state. And that is important.
Yeah. Okay. Briefly, did we talk about the treatment options, the duration?
Okay, so there are several. First, we'll start depending on what your level is. If your level is not alarming, then I will give you the finasteride, which will decrease your PSA level. Okay, or I might give you both if you're having interruption in your stream. I might give you both the finasteride and the Flomax, or the other name for the Flomax is tamsulosin. Okay. Now, if I see where, hey, I've done his level and his baseline has double or triple, then I will send you to the urologist. And then they will do further testing and might need to do biopsy. And if that biopsy comes back that is cancerous, then they might treat with chemotherapy or radiation or surgery. Or sometimes they would do 2 of the 3.
Okay.
So it just depends on what your and the treatment plan will be contingent on what that Gleason score is. So like I said, 6 is low risk, 7 to 8 is moderate intermediate risk, where they would do the most times they would do radiation and or chemotherapy or both. And then if it's 9 to 10, that's high risk. Okay, now that might be in the stage 4 or what have you, stage 3 to stage 4, then they might have to do surgery or do surgery and radiation, or surgery, most times surgery and radiation, or surgery and chemotherapy, depends.
Okay.
Yeah. But then that's out of my scope. That would be the urologist.
Okay. And so tonight, that's what we have for you tonight. It was very interesting interaction. So we're talking about your prostate health. It is good to do your checkup. It is good to know what is happening on time, and so you can seek for treatment. The different options, you can have them, because there are some times when you have gone to a very severe stage. You don't have any option anymore, so it's better you have options. So we want to say thank you to a nice practitioner, our physician in the house. Want to say thank you for being here tonight again, and want to say thank you to our viewers. I also want you to know that we are still not out of the woods as a concern coronavirus. So you have to protect yourself, be safe, do all the safety measures that you have to do or you have to take, and make sure your family is also safe, your community is safe. Take the vaccine if you have not done so. Make sure you take it, especially those with underlying conditions, because it can be very, very terrible when you have other underlying conditions. Talk to your physician, talk to your doctor. And most especially, I want you to know that the doctor treats, but God heals. God is our
Exactly.
healer. He is the greatest physician. But God has given us the knowledge, He has given us the wisdom, and He has prepared these people to be able to help. So they are there to help. So when you need a help, make sure you seek, make sure you ask, and I believe it's going to be available for you. Tonight, wherever you are, if you are sick, the word of God declare by His stripes you are healed. I speak healing into that situation tonight in the name of Jesus. Whatever your health condition is, may the power of God locate you tonight. May the medication you are taking, may it work for you in the name of Jesus. May the people that surround you, the medical practitioner, the wisdom they need to operate in the field, may the Lord give it to them in the name of Jesus. So tonight I speak healing. You are healed in the name of Jesus. God bless you tonight. And this has been a presentation by the Fortified City International Ministries. And I want to say thank you. I want to give you just 1 minute, my special guest in the house, so you can just say a last word before we close.
Well, with God, all things are possible.
Amen.
However, God made medicine for a reason. So, and God helps those who help themselves.
That's right.
So we have to do the spirituality with the Western medicine as well.
Yeah.
And as our sister said, COVID is still around. Please take your vaccine. This is not a conspiracy. COVID is not a conspiracy. Some people still think that it is. There is a booster that is out. So please take the booster when it's at your age to get it. Please take it, because
Okay.
that vaccine saves lives.
Amen. And I also want you to know, if you are in Liberia, this program is being relayed live on Radio Lofa, which is 99.3 FM in Funchema, Lofa County. So you can always tune in on the Thursday, tune into 99.3 FM Funchema radio station. So you will be hearing us live. So God bless you tonight. And this has been your host, Pastor Patience, and we will be here again next Thursday with another edition of Health Matters. Your health matters. Your health matters. God bless you tonight.
Good night.